Has someone you love started exhibiting subtle, yet concerning changes over the past year? Many people mistakenly believe that death in old age occurs abruptly. However, the reality is that the body often subtly signals its decline months, sometimes even a year before reaching its final stage. The challenge lies in the fact that these signs often appear insignificant at first, making it difficult for individuals to recognize them. Only upon retrospectively examining the clues do families realize that they were present all along. Unfortunately, by then, it becomes too late to prepare adequately or ensure that the final moments of their loved one's life are filled with comfort, dignity, and peace. In this video, we will explore 5 crucial signs that frequently emerge a year before an elderly person's passing. Some of these signs may have been overlooked or dismissed as mere signs of aging, while others might appear minor but actually indicate the body's gradual deterioration. Recognizing these signs early provides an opportunity to enhance care, cherish meaningful moments, and most importantly, ensure that your loved one's final phase of life is characterized by tranquility, respect, and acceptance. Stay with us until the end, as these 5 signs can assist you in emotionally and practically preparing for what lies ahead. Understanding the underlying process empowers you to remain unperturbed and make the most of the time you have left with those you cherish. Now, let us embark on this journey. Sign 1. Significant weight loss. One of the earliest and most evident indicators that a person may be approaching the final year of their life is unintentional weight loss. Initially, it might seem subtle, such as a belt needing to be tightened, clothes appearing looser, or a once hearty appetite gradually fading. Many families dismiss it as a natural part of aging, but the truth is, losing weight without intentional effort is rarely a positive sign. It often suggests that the body's ability to absorb nutrients is impaired. Muscle mass decreases and essential systems slow down. While aging naturally leads to some muscle loss, it occurs at a pace that becomes concerning when it happens too rapidly. The body may struggle to digest food properly or no longer process protein effectively, leading to muscle wasting. This loss of strength makes movement more difficult, increases the risk of falls, weakens the immune system, and leaves the person vulnerable to infections. Another reason for weight loss in the final year of life is appetite changes. Many elderly individuals simply don't feel hungry as they used to. Their sense of taste fades, food no longer seems enjoyable, and they might start skipping meals or eating smaller portions. This isn't just a matter of preference, it's a physiological change. The body, sensing its decline, no longer signals the brain to seek food as often, resulting in less energy, strength, and a gradual decline in overall health. Underlying medical conditions also play a role. Weight loss is a common symptom of chronic diseases like cancer, heart failure, or kidney disease, which can progress long before more obvious symptoms appear. Even conditions like depression or cognitive decline can lead to reduced eating, causing a downward spiral where the body doesn't receive enough fuel to sustain itself. Some families try to address the issue by encouraging their loved ones to eat more, offering favorite foods or supplementing meals with protein drinks. However, if the weight continues to drop despite these efforts, it's crucial to recognize that the problem isn't solely about diet. It's the body preparing for a deeper transition. At this stage, forcing large meals may not be helpful. Instead, focusing on comfort and easy-to-eat foods and hydration can make a greater difference in maintaining quality of life. If you notice significant weight loss in an elderly loved one, especially if they are eating less, feeling weaker, or struggling to stay active, it's essential to pay attention. This isn't just about physical appearance, it's about the body sending a message. Understanding this message now can help you prepare for the journey ahead with clarity, compassion, and the ability to make every remaining moment meaningful. Another significant change is extreme fatigue and weakness. One of the most noticeable shifts in the year leading up to the end of life is a deep, persistent fatigue that persists even after rest. It's not just feeling a bit tired after a long day. It's a profound exhaustion that makes even simple tasks feel overwhelming. Getting out of bed becomes a struggle, and walking across the room requires effort. Activities that once felt routine, such as cooking, dressing, or even holding a conversation, start to feel too draining. This isn't just a result of aging, it's a sign that the body is conserving its remaining energy. As organ function begins to slow down, the body prioritizes what's most essential. The heart doesn't pump as efficiently, circulation weakens, and muscles don't receive the same level of oxygen they once did. This is why many elderly individuals in their final months feel weak, unsteady, and unable to sustain the same level of activity they once enjoyed. Another crucial factor is metabolic slowdown. The body is designed to produce and utilize energy, but as it prepares for its final phase, that energy is redirected. Instead of fueling movement, the body shifts toward preservation. This is why someone in decline may start sleeping more, requiring longer naps during the day, and finding it harder to stay awake for extended periods. Some may even experience sudden drops in energy, where they seem fine one moment but completely drain the next. However, perhaps the most heartbreaking aspect of this process is the emotional impact of fatigue. Many seniors who once took pride in their independence begin to feel frustrated or even embarrassed that they can't do what they used to. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies. This isn't because they don't care, it's simply because they simply don't have the energy. This can lead to a cycle of isolation where they cease trying altogether, which only hastens the decline. For families watching a loved one, transitioning from active and engaged to exhausted and withdrawn can be distressing. It's easy to assume they're simply being lazy or that they need to push through it. However, forcing activity won't be beneficial. What truly matters is understanding their limitations, allowing them to rest when necessary, and making their remaining days as comfortable as possible. If you notice a loved one experiencing persistent, deep-seated fatigue that isn't alleviated by rest, consider it a sign that their body is undergoing a significant transition. This is the time to cherish conversations, create moments of tranquility, and support them without expectations. Ultimately, what matters most isn't their ability to perform, but rather that they feel loved, understood, and at ease. If you're still watching this video and finding these insights valuable, please comment on the second video below to let me know you're here. Additionally, if you haven't subscribed yet, I highly recommend subscribing and turning on the bell to ensure you don't miss any videos. Your support helps us continue creating informative and inspiring content. Now, let's move forward. Number 3. Increased cognitive confusion or withdrawal. As a person approaches the final stage of life, one of the most noticeable changes can be observed in their thinking, communication, and interactions with others. You may notice that someone who was once sharp and engaged begins to forget things more frequently, struggle to follow conversations, or seem disoriented in familiar surroundings. They might repeat themselves, forget names, or lose track of time, even when they never had memory problems before. These subtle cognitive changes can occur months or even a full year before death. This isn't just ordinary forgetfulness. The brain, like any other organ, requires a consistent supply of oxygen and nutrients to function optimally. However, as circulation weakens and oxygen supply to the brain decreases, cognitive function starts to decline. As someone nears the end of their life, they may experience various changes in their cognitive and emotional state. One common sign is confusion, which can manifest as difficulty making decisions, recognizing familiar people, or experiencing brief moments of lucidity followed by sudden episodes of confusion, as if their mind is fading in and out. Another sign is emotional withdrawal, where individuals nearing the end of life may lose interest in social interactions. They might speak less, engage less, or spend extended periods sitting in silence, not because they don't care about their loved ones, but because their brain no longer processes emotions and engagement the same way. Conversations can become tiring, loud environments feel overwhelming, and eventually, many seniors retreat into their own world. Changes in mood and behavior are also common. Some individuals become more irritable, anxious, or easily frustrated, while others appear unusually calm, detached, or indifferent to things that once mattered to them. This isn't just a personality shift, it's often a result of the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and the person may stop reacting to situations in the way they used to. For family members, this stage can be particularly challenging. Watching a loved one lose touch with reality or emotionally withdraw can feel like losing them before they're actually gone. However, it's important to remember that this is something they can't control. Instead of trying to bring them back into conversations, the best thing you can do is meet them where they are, speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, confused, or less engaged, it's crucial not to ignore these signs. These are often early indicators that the body and mind are preparing for the final transition. This is a time to be patient, cherish quiet moments, and create an environment that feels safe, familiar, and peaceful. Even when words fade, love and comfort can still be felt. Let's move on to the fourth point: frequent infections and slow healing. As the body begins to wind down, one of the clearest physical signs is a weakened immune system. You might notice that someone who rarely got sick before now seems to catch every cold, flu, and minor infections circulating. What used to be minor illnesses now take much longer to recover from, and simple wounds like cuts or bruises heal noticeably slower. These changes aren't random. They're signs that the body can no longer defend or repair itself as effectively. One of the biggest concerns is repeated infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system weakens. Many families assume these are isolated illnesses, but when they start happening frequently or take a long time to clear up, it's often a sign that the body is losing its ability to fight back. Even antibiotics, which once worked quickly, may seem less effective. The person may need stronger medications, longer recovery periods, or multiple rounds of treatment for infections that once would have been minor. This happens because as circulation slows and organ function declines, the body simply doesn't respond to treatment as well. Another overlooked issue is chronic wounds. If you notice that small scratches, sores, or bruises aren't healing properly or keep reopening, it could mean that circulation is compromised. Poor blood flow means that oxygen and nutrients aren't reaching the skin and tissues efficiently, making healing much slower than usual. Pressure sores, especially for those who are less mobile, become a serious risk and can lead to dangerous infections if not carefully managed. What's even more concerning is that infections in the final year of life often don't look the way we expect. Instead of a high fever, an elderly person may simply appear more tired than usual, confused, or less interested in eating. In fact, for seniors, a sudden drop in mental alertness is often the initial warning sign of an infection, even before other symptoms manifest. This is why recognizing these changes early can significantly enhance the comfort and support they receive during their final phase of life. For families, witnessing a loved one repeatedly contract infections can be both frustrating and emotionally draining. It's tempting to resort to aggressive treatments, hoping that a single round of antibiotics or a hospital stay will resolve the issue. However, at a certain point, the focus often shifts from curing to providing comfort, ensuring proper hydration, maintaining clean and moisturized skin, and minimizing stress on the body. In fact, minimizing stress can have a more profound impact on their well-being than another round of medication that only prolongs suffering. If you're still watching this video and finding these insights valuable, please leave a comment at number 4 below to let me know you're here. Additionally, if you haven't subscribed yet, I highly recommend subscribing and turning on the bell to ensure you don't miss any future videos. Your support is instrumental in helping us continue creating informative and inspiring content. Now, let's move on to the next point. Number 5. Significant changes in breathing or circulation. One of the most evident signs that the body is preparing for its final stage is a noticeable alteration in breathing patterns and circulation. You may notice that your loved one breathes more slowly or shallowly compared to before. At times, they might pause between breaths, or their breathing may become irregular, alternating between rapid and slow breaths unexpectedly. Some individuals experience a gentle, rhythmic breathing pattern known as Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and prolonged pauses. These changes may begin subtly, but gradually become more pronounced and frequent over time. Another common sign is weakened circulation. You may notice that their hands, feet, or even their nose and ears start feeling cold to the touch. The skin may appear pale, bluish, or bluish-gray, especially around the fingers and toes. This occurs because the body prioritizes blood flow to vital organs, reducing circulation to the extremities. It's a clear indication that the heart isn't pumping as strongly as before. Some individuals also experience increased shortness of breath, even with minimal movement. Simply sitting up, speaking, or shifting positions might cause them to feel winded or out of breath. They may also breathe through their mouth more frequently or suddenly need to stop and catch their breath while talking. If they were once able to walk across the room easily but now struggle to do so, their lung function may be declining. In some cases, fluid buildup in the lungs can make breathing more challenging. This can lead to a persistent cough, gurgling sounds, or even a feeling of tightness in the chest. Many people assume it's just congestion from a cold, but in elderly individuals nearing the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to alleviate their breathing. For family members, witnessing these changes can be frightening. It's natural to want to help, to encourage them to take deeper breaths, or to worry that something urgent is happening. However, in many cases, these changes are simply the body's natural way of slowing down. While there may not always be a way to reverse these changes, there are ways to make them more comfortable. Maintaining a cool room temperature, using a humidifier, or offering small sips of water can help alleviate discomfort. In some instances, medications or oxygen therapy may provide relief, but the focus shifts towards comfort rather than attempting to resolve the underlying issue. If you notice these signs of changes in breathing, cold hands and feet, or a bluish tint to the skin, it's important to pay attention. These are often indicators that the body is conserving energy and circulation is slowing down. It's a time to be present, offer reassurance, and create a peaceful environment where they feel safe and at ease. In these final months or weeks, the most crucial gift you can give them isn't medical intervention, it's comfort, dignity, and the knowledge that they are not alone. As we conclude this video, take a moment to reflect on our discussion. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation are 5 signs that often appear in the year leading up to an elderly person's passing. These signs may not manifest simultaneously or always be evident initially. However, when you start noticing them, it's a clear indication that the body is preparing for its final transition. For many families, these changes can be challenging to accept. It's natural to want to fight against them, encourage a loved one to eat more, move more, or push through exhaustion. Nevertheless, sometimes the best course of action is to listen to what their body is communicating. Instead of fixating on trying to reverse the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about harboring fear of death, it's about being prepared for it. When you recognize these changes early, you can provide better care, make informed decisions ahead of time, and ensure that your loved one's final months are filled with love, dignity, and cherished moments. Sharing stories and letting them know they are valued and not alone are essential during this time. If you're noticing these signs in someone close to you, take a deep breath and remember that you are not alone in this journey. Many families have walked this path before, and while it is never easy, knowing what to expect can provide strength, patience, and peace. Thank you for joining us today. We would love to hear from you. Leave a comment below and share something you learned today. How do you plan to use it in your life? Your thoughts are valuable to us, so don't be shy to share them. Reading your comments gives us immense motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us keep creating informative and inspiring content. Thanks for watching, and we eagerly anticipate seeing you in the next video.